Welcome to H360 Health Talk. We're here today with Dr. Robin Miller, author and medical director from Medford, Oregon. Dr. Miller is the author of 3 books. Her first, A Smart Woman's Guide to Midlife and Beyond. Her second book, Kids Ask the Doctor. And her most recent, Healed, Health and Wellness for the 21st Century, which draws upon insights and knowledge and anecdotes from 33 years of treating her patients. She blogs, she sees patients, she works with Dr. Oz. Doctor, good to see you here today.
Thank you. Thanks for having me.
Yeah, your new book, fascinating, but I want to start out by asking you, we all know that a healthy heart, brain, and gut are kind of the ways to a happy and healthy life. But are there some new risk factors that you're finding that we now should be paying attention to?
Yes, absolutely. So one of the reasons I wrote this book is because there's some new things coming out that are actually out that patients need to know about so they can drive the train. Because oftentimes doctors take a while to catch on to these things. So when it comes to the heart, we all know what the risk factors are. High blood pressure, smoking, stress, sedentary lifestyle, obesity, high cholesterol, high blood pressure. But there's a new one. It's called TMAO, trimethylamine oxide. So when you eat red meat, farm-raised fish, egg yolks, the bacteria in your gut form trimethylamine oxide, which is probably a better risk factor than cholesterol in terms of stroke and heart attack. It's a direct correlation. High TMAO, high risk for stroke and heart attack.
So how do you get measured for this? Is this something that's a normal test when you have blood work done, or not hearing about it before and having blood work done for things like high triglycerides? I don't think I've ever heard this in the panel that my physician orders. How do you get this test?
It's easy. It's a blood test. It's done fasting. Your doctor will have to ask for a kit from Cleveland Clinic. They'll send it to him or her. It's really simple. You bring the kit to the lab. Cleveland Clinic actually pays for the blood draw. It's an $8 test.
That's incredible.
It is.
So we know that there's all sorts of things that you can do to lead a happy and healthy life. And now, we're learning about this new compound, TMAO. So what are some of the keys and evidence that you're seeing to a long and healthy life?
Well, getting back to the TMAO piece, there's some things you can do if you do have high levels. If you don't want to cut out red meat, egg yolks, and farm-raised fish.
Right.
So you can add grapeseed extract to your diet. You can add extra virgin olive oil to your diet.
Okay.
Or when you eat a steak, you can drink Guinness Stout.
Really?
Yes. Guinness lowers TMAO levels.
Interesting.
So the grapeseed oil, let's go back to that for a minute. So how different is that from like a fish oil? Tell me about the difference when we talk about fish oil and we talk about grapeseed oil and we talk about supplements. And I also want to get back, because this seems to be a gut issue primarily. All of the information that's been out, I guess, over the last year or so about probiotics and paying attention to the gut. Are there other supplements that we should be looking at?
So fish oil is omega-3. Grapeseed extract is mostly more of an antioxidant. And fish oil is really important because it will bring down your triglycerides. It's really good for overall general health. So that's a good supplement to take if you're not eating fish 2 days a week. I always think it's best to get your supplements through your food.
Right.
So there are certain things you can't get enough of. So magnesium's maybe one of them. Calcium, 800 milligrams a day total, including your food. And vitamin D. Everyone thinks they're getting vitamin D by being out in the sun, but then they use sunscreen, so you're not getting it.
Yeah.
So you need to make sure you take vitamin D if you're not getting enough. I suggest patients get their levels checked. It's really important. The other vitamin that's important to check is B12. Because as we get older, or if you're taking a proton pump inhibitor like Prilosec, you may not be absorbing it. So those things are important. So getting back to your question, for a long and happy life, we need to be healthy. And for that, we need a healthy gut, and we need to eat healthy. And by eating healthy, I mean a whole foods diet. Diets are different for everybody.
Right.
What makes you healthy may not make me healthy. So finding that balance for yourself, whole foods, organics, stay away from fast food. The great example of fast food diet is Morgan Spurlock's book,
Yeah.
Super Size Me.
Yeah.
That was amazing. So here you have this guy who is eating McDonald's for a solid month. They're begging him to stop because his liver is deteriorating. It's disintegrating in front of their eyes. He becomes depressed, fat, achy. It's awful to watch. And you can watch it in the movie.
Yeah.
Right. It's an incredible movie.
It is.
And you bring up depression, which is a really important topic. I think it affects something like 25% of the U.S. population. So what kind of approach do you suggest for treating depression? Is there something that you could do that maybe doesn't involve medications?
Yes, and it all goes back to the gut again. So if your gut's not healthy, your odds of being depressed are pretty good. So there are a couple things I recommend. One is obviously eating healthy. And there's evidence to show that your eating affects your mood. So they have a great study that was done with mice, on obesity actually, but it also showed behavior, where they did a fecal transplant. And fecal transplants where you take poop from one mouse to the other. Simple, super easy in a mouse because you just paint it on their little arms and they'll lick it off. So they took a fat mouse and they took a skinny mouse that was anxious. And they painted the poop of the skinny, anxious mouse on the fat mouse. And he was chill then. So he starts to lose weight after the fecal transplant and get anxious. Pretty interesting.
That is interesting. I've heard of fecal transplants also done in humans, but I think to treat things like Crohn's disease.
They're not using it for Crohn's right now. It's only for antibiotic-associated colitis, but maybe one day they will use it for Crohn's.
Yeah, it's an interesting field.
It is, and now we have poop banks.
Yeah.
MIT.
All right.
Very smart poop.
Very, very smart.
But there's something else for depression that I always do, and there's a gene I test for. It's called MTHFR. And what it does is it codes for enzymes in your gut that help you process folic acid, and folic acid is important for your mood. So if you have one mutation on that gene, you're going to be down 30% in the compound L-methylfolate that is made from those enzymes. L-methylfolate is what your body uses to make serotonin, dopamine, and norepinephrine, all those things that make you feel good and make you happy. If you have two mutations, you're down by 74%, and have been your whole life. So the treatment's pretty simple. I just give people L-methylfolate and see what happens in terms of their mood. The other very interesting thing is irritable bowel syndrome often gets better with L-methylfolate because what people don't realize is that their gut is lined with brain cells. If I took a brain cell and a gut cell under the microscope, they would look the same.
Interesting.
So if I give people L-methylfolate, not only does their mood often get better, their IBS goes away.
Oh, wow.
So one of the things you said was that diets are individualized to the person. And we see so many people, there's so many books out and so many fad diets, right? That says, here's a new diet for the masses, try this, whether it's a low carb or no carb diet, whatever it happens to be. So it's refreshing to have somebody come in and say, a diet is a very individualized thing, and what works well for you might not work well for somebody else. Recently, coffee's been in the news. Coffee is an antioxidant. It's good for you. Drink more coffee. What's your opinion about that? And can we think about chocolate in the same way? We hear that dark chocolate is also good for you. What's your opinion about this?
I love them both. Coffee is something I really, really like, so I'm always looking for the downside of it. So there are people that don't metabolize it properly, and those people shouldn't be drinking coffee. However, if you are a normal metabolizer of coffee, then coffee has great benefit. It helps keep you alert. We've shown that, especially in the morning if you drink it. It helps prevent ringing of the ears in women. It helps prevent certain cancers like endometrial cancer. It helps with depression and overall mood. It's actually, there's no downside to it that I've found, except that if you drink too much, you can get jittery. If you stop drinking it abruptly, you'll get a wicked headache if you're used to it. And you have to stay away from those really high sugary drinks.
Yeah, well, exactly. You're not talking about coffee with, heavy cream and loads of sugar.
Exactly.
Right? We're talking about a black cup of coffee.
Yes, or you can put cream in it or milk. Because if you don't, then it'll wash the calcium out of your bones.
So how does green tea stack up? We hear a lot about the benefits of green tea. If you put that side by side next to coffee, where do you come out on that discussion?
Oh, that's a good question. I believe that green tea probably has more of the antioxidants and the anti-cancer properties, but I don't know specifically how they march out next to each other. But they're both good.
How do you know if you metabolize coffee well or not?
You have to get a test, actually.
Oh, okay.
You wouldn't know just by drinking it. Although it's interesting, the people that don't metabolize it well generally don't like it.
Okay.
So if you don't like it, pay attention to that.
Right.
But there is a gene test, and I do actually a fair amount of gene testing when it comes to medications. And there is one for food. But let me just say something about chocolate before we get to that.
Yep.
Chocolate's really good for you too. And small amounts. So they've done studies where they found it reduces the risk for heart disease and stroke in populations, actually. Question is, are those people at lower risk anyway, those people that eat chocolate? I don't know for sure. It also improves blood flow to the brain. If you have low blood flow, it improves it. So they did a study on seniors where they gave them 2 cups of dark hot chocolate every day and did MRIs and found that indeed it did improve the blood flow to the brain for those that were impaired to begin with. But in terms of let's go back to the gene testing. I actually, when people are depressed and the L-methylfolate doesn't help them, sometimes they do need medication. And so there's a test to find out which medication would be best, and it's a gene test. It's called GeneSight. I do that on everyone that I am considering putting on an antidepressant. Very helpful, because we all metabolize things differently. So if you're a slow metabolizer of a medicine, it's going to give you side effects and it's not going to work. If you're a rapid metabolizer, you're not going to get any benefit because it's not going to be able to get to a level that's going to work for you.
Right.
So I do that, and then there's actually a test on how you process food. It's not in the book, but it's very cool. It's called VitaGene.
Okay.
And you can go online and order it. It's inexpensive, but it kind of addresses the individuality of diets. So for some people, carbs are their problem. For some people, fats are their problem. For some people, salt's a problem, sugar's a problem. That test will tell you who you are. What kind of diet? Yeah, what kind of diet should you be on? Are you that person that has a lactose issue or a wheat issue? It actually does the genetic test for celiac.
And so when you're talking about a test to process food, what does it mean to process food? You take in food, the body is supposed to extract the good things, use the good things, in the functioning of the body, and the waste comes out. Is that what we're talking about here, and how easily your body handles that process based on the foods and, I guess, your genetic makeup?
Yes, and how you metabolize it. So some people, fats are great. They get the energy from fats. They don't store it in funny places. It doesn't make them sick. They don't gain a lot of weight from that. Whereas other people, carbs are a problem.
Yeah.
And so I did the test. I'm a carb person.
So let's switch gears for a minute. Medicinal mushrooms. Some people, believe that there's some medical benefit, whether it's, in helping with cancer. Where do you fall out on medicinal mushrooms?
Oh, I think they're great. Medicinal mushrooms can be incredibly helpful. They're antiviral. They have many anti-cancer properties. They help your brain. It's pretty amazing. I have a story in the book about a woman who I took care of who had a Merkel cell tumor. It's a weird skin cancer. And usually by the time it's shown up, it's already spread. So she came to me, and I started her on a blend of medicinal mushrooms from Host Defense. Host Defense is the only brand I use, and I don't get any money from them, but I use them because I know their mushrooms are good, organic, and clean, and that's what you want. And they come in capsules. It's easy. So Paul Stamets is the owner of the company, and he had a blend, Stamets 7, that I started her on that had lion's mane and 6 other mushroom types in there. And then she was having back pain. And turns out that lion's mane, which is a very cool mushroom, looks like a lion's mane, tastes amazing, helps with nerves and brain stuff. So this is a nerve cell tumor, the Merkel cell is. And also she was having back pain. So I put her on extra lion's mane thinking maybe it would help her back pain, and forgot about it. Well, the time between she had the biopsy and the tumor taken out was about 6 weeks. And she went up to a specialist in Washington. And a couple weeks after he'd taken the tumor out, he called me and said, "What did you do to this patient?" I'm like, "I didn't do anything." And it turns out that between the time of the biopsy where the cancer cells were very healthy, the tumor cells were dead. Dead. And he asked me what I'd done. I told him about the lion's mane, and sure enough, lion's mane actually helps Merkel cell tumor when it's metastasized, they found. And my patient's cancer-free 11 years later, and that's very unusual. So he was going to do a study on it, but he couldn't get funding, and you know how that all goes. Anyway, but he does recommend it to his patients that they try it. And it's helped, he's told me it's helped many of them, not all of them, but many of them. So Merkel cell tumor was, for my patient, cured with the lion's mane. So once I had done that, Stamets actually called me. It's like, oh my God, he's like a rock star to me. And he told me about his mother, and his mother had had a breast cancer. She was in her 90s, he was living out in the middle of nowhere. The doctors didn't want to do anything. So he put her on 4 of his My Community blend, which is a blend of 17 different mushrooms, and turkey tail, which is used as chemotherapy for breast cancer in Japan. And now NIH is actually looking at it. And it actually, her tumor was gone after that. So he did 4 of the My Community in the morning, 4 of the turkey tail in the evening, and her tumor went away. Now, I don't ever recommend that people do mushrooms alone, but certainly augmenting chemotherapy, it definitely helps. And there's a particular mushroom, maitake mushroom, that helps with the side effects of chemo as well. So medicinal mushrooms are incredibly helpful. They keep you from getting sick if you fly all the time. If you're worried about getting sick in New York City, just take your My Community in the morning. You'll be fine. So they're amazing.
That sounds incredible. So, we're coming up into the winter, which is a very stereotypical time for cold sores. However, we know that the herpes virus can hit at any time. So is there any sort of natural treatments that you recommend for people who may be suffering from the herpes virus?
Yes, it's lemon balm.
Lemon balm.
Yes, lemon balm is amazing. It kills the virus.
Okay.
There are studies that shows it reduces the intensity of the outbreak. I use it. I used to get cold sores all the time on my mouth, and I use it every night, and I haven't gotten one in a really, really long time. And there's a great study in Germany that showed if you do lemon balm at the beginning of an initial outbreak, you'll never have another one again.
Now, is it actually like a topical treatment, or is it also a capsule that you could take?
It's more of a topical treatment. You can make a tea, but I think it works better topically. And if you have genital herpes, you can put it in a bath and soak in it, or use it as a gel.
Oh, wow.
And you can find the gels online. On Amazon has everything.
Yes, they do.
Go to Amazon.
So you talk about something called Scream Cream. Tell me a little bit about.
Takes a while to get there.
We're going to shift gears from cold sores to spicing up a woman's sex life, and men kind of. I don't want to say we have it easy because there's things like Viagra and Cialis out there that for men that might need a little help. But tell us what Scream Cream is.
Scream Cream is actually Viagra cream for women. So it's Viagra, aminophylline, and arginine. Those are all things that dilate blood vessels. And so you put it on the clitoral area, wait just like the guys do, about 45 minutes, and bingo. You're 16 again.
Is it 16?
It's great. It's great for women. As we get older, sometimes our sensation dulls. It happens when people are on certain medications, like antidepressants will do that. So it kind of brings you back to where you were. And I had a great example of a woman who had had a stroke. And sex was really an important part of her relationship with her husband. She totally enjoyed it. And then I had to put her on an antidepressant, just a low dose. And everything kind of went out the window. She wasn't enjoying herself. She wasn't getting any orgasms out of anything. So I gave her Scream Cream. And sure enough, she came back.
And is this an over-the-counter or
No.
a prescription only?
It's not made by compounding pharmacists. So sometimes what they'll do is they'll replace the aminophylline with nitroglycerin, which I would not recommend because it'll give you a headache. So yeah, you want to ask All the compounding pharmacists know about Scream Cream.
Interesting.
Not to switch back to a boring topic or anything, but sometimes antidepressants can cause unwanted weight gain. Do you recommend any certain way for naturally losing weight without going on to any of these fad diets? Is it taking some of these genetic tests and finding out what foods are best suited for you?
That would help, but there's some other little tips. So one of the coolest things we talk about in the book, there's a study that they did on, it was like 90 women who were overweight in Israel. They divided them into 2 groups. They gave them the same food, the same calories every day for 12 weeks. Only one group got 700 calories for breakfast, 500 calories for lunch, 200 for dinner. The other group, they flipped around, 200 for breakfast, 500 for lunch, 700 for dinner. The breakfast group lost 17 pounds. The dinner group lost 7 pounds. So if you...
Wait, say this again?
So this breakfast group, the ones who got most of their calories in the morning,
Right.
lost 17 pounds.
Yeah.
The dinner group, only 7.
Makes sense, though, right? If you
It
think
does,
about it.
but it's the same food, it's the same calories, same activity level. Just by flipping it around, you can lose weight. So if you did nothing else but change the order of the food you ate in the day, you'll lose weight.
Yeah.
Also, it's the little cheats along the way that get you. So you need to see what foods are your problem. So if it's carbs, stay away from the white stuff, breads, pasta, rice, potatoes. And it's just the little amounts that get you. People always say, I don't understand how I'm gaining weight. But I had 10 pounds of fruit yesterday. Well, fruit has sugar in it.
Right.
It's healthy, but maybe not so healthy in huge quantities.
Right.
And it's the bread on the sandwich. It's that little cracker you pick up. It's eating off your kids' plates. That used to be my problem.
And it's those little things that, although you think you're only eating a little bit of this, a little bit of that, they add up.
They do.
Over time.
That 50 calories every day adds up to pounds over time.
Yeah.
So you really need to be conscious of what you're eating every day. If you're going to cheat, my advice is only do it 1 day a week. And then when you get to that day, you realize, I didn't want that. You can save it till then. You're like, what's this?
It's those goldfish crackers we keep in the office that
Right.
seem to get me in the middle of the day. When you begin to get hungry, it's convenient, it's easy, it's quick, and it's pretty doggone good tasting. So you put all you put all that together,
Right.
and there you have it. Let's talk about Alzheimer's disease for a minute. My mother's an Alzheimer's patient. I spend a lot of time, looking at this area. Are there activities or things that you see in Alzheimer's patients that could help improve, their quality of life? As we all know, there's no cure for Alzheimer's. But are there some things that we can do maybe early on at the first sign of memory loss that might help extend, the time before you're, a real late-stage Alzheimer's patient?
Yes, actually in the book I talk about this program called the MEND program. Very interesting, fascinating actually. It's a small study. They took 10 people who had either mild cognitive impairment and early Alzheimer's, or there was somebody in the study who was more advanced. And what they did was they optimized their entire care. So they took gluten out of their diet. They gave them whole food diets. They had them exercising at half an hour every day, meditating, reducing their stress, optimized their magnesium, their zinc, their vitamin D. Everything was optimized. One of the patients in there had been taken off of her hormones, menopausal hormones. They put her back on. And she came back to normal. She's still normal 3 years later. 9 out of the 10 of the people reverted back to their normal cognitive function. 1 did not. It was a more advanced patient that did not. So it's a lot about how we do what we do. So eating healthy, exercising, reducing our stress has a big impact on our brain function. Very important. So that's number 1. And there is an activity that can really make a difference. Exercise is important for everything. But they did a study on Alzheimer's, or looking at Alzheimer's patients. They took seniors between the ages of 75 and 85, over 400 of them, and followed them for 5 years. At the end of that time, 124 had developed dementia or Alzheimer's disease. Then they looked at their activities that they had done, and they found that there are certain activities that don't reduce your risk. Golfing, swimming, bicycling, although they're good for you, they don't reduce your risk. Reading does by 35%. Crossword puzzles by 47%, but there was one activity that reduced it 76%.
You got me.
Ballroom dancing. Partner
who-
dancing.
Huh. And why is that, do you think? Is it remembering the steps, and does it have something to do with music? You know, we hear a lot about music in Alzheimer's patients, and there's a couple of studies out that look at that. So why ballroom dancing?
It's ballroom partner dancing, so you don't have to remember any steps, you just have to follow or lead, right?
Okay.
And it's that interaction that happens, it's so fast. That interaction that goes on between the brains and the body and everything that's going on through a dance that builds new neural networks. And it keeps the brain healthy. And it also helps with Parkinson's disease as well, because it bypasses the part of the brain that's damaged. So Parkinson's patients can dance. They also can walk if they have a standard beat. So they'll walk to music. I found a great video that shows this, where this man is just shuffling along, then they play this music that has a steady beat, and he's not even using his walker anymore.
Well, I was going to say, I would imagine that the balance and things, or maybe social anxiety, would also benefit from dancing.
Oh, yes, it's amazing. Depression, social anxiety, it probably even helps with cancer recovery for many reasons. Being touched, doing something fun, and having exercise also really helps. There's one other very interesting thing about Alzheimer's disease, and that is that they did a study on nuns. It's in the Midwest. It started in the 70s, of course. And they found that the nuns and priests allowed the people in the study to autopsy them after they died. And they kept journals, and so they followed these people. And there were, I think, about 10 of the nuns who, on autopsy, had Alzheimer's disease, many tangles in their brain, but never showed it in life. So it gets back to long, happy life. What they found is they all had an incredible sense of purpose and determination to do what they wanted to do in their life.
Right.
So I think that makes a big difference in terms of a long, healthy life as well.
That's very interesting. So you think maybe intently focused on a single thread.
Or having passion for something. It can be
Yeah.
anything.
Yeah,
Passion, love, those things are really important for a long, healthy life.
yeah.
I think they really help with depression as well. you know.
Absolutely.
I see so many people who are just kind of the cog in the wheel, and they're just dealing with depression all the time. So having that bit of passion, I think, is really important.
Absolutely.
Well, Dr. Robin Miller, her new book, Healed, Health and Wellness for the 21st Century. Doctor, thank you for coming in.
Thanks for having me.